Today's medical forum, we will be looking at mental health. Definition of mental health, risk factors, types, early signs, diagnosis, treatment, and maintaining mental health. Mental health refers to cognitive, behavioral, and emotional well-being. It is all about how people think, feel, and behave. People sometimes use the term mental health to mean the absence of a mental disorder. What is mental health? Mental health disorders are one of the leading causes of disability in the whole world. According to WHO, mental health is a state of mental well-being that enables people to cope with the stresses of life, realize their abilities, learn well and work well, and contribute to their community. The WHO states that mental health is more than just the absence of mental disorders or disabilities. Peak mental health is not only about managing active conditions, but also looking after ongoing wellness and happiness. It also emphasizes that preserving and restoring mental health is crucial individually and at a community and society level. Risk factors for mental health conditions. Everyone is at some risk of developing a mental health disorder, regardless of age, sex, income, or ethnicity. In the US and much of the developed world, mental disorders are one of the leading causes of disability. Social and financial circumstances, adverse childhood experiences, biological factors, and underlying medical conditions can all shape a person's mental health. Many people with a mental health disorder have more than one condition at a time. The following factors can contribute to mental health disruptions. Continuous social and economic pressure. Having limited financial means can increase the risk of mental health disorders. Socioeconomic conditions, occupation, a person's level of social involvement, education, housing quality, gender, age, ethnicity, and nationality. Having a gene associated with a mental health disorder does not guarantee that a condition will develop. Likewise, people without related genes or a family history of mental illness can still have mental health issues. Chronic stress and mental health conditions, such as depression and anxiety, may develop due to underlying physical health problems, such as cancer, diabetes, and chronic pain. Types of mental health. Anxiety disorder. People with these conditions have severe fear or anxiety related to certain objects or situations. Most people with an anxiety disorder try to avoid exposure to whatever triggers their anxiety. Below are some examples of anxiety disorders. Generalized anxiety disorder involves excessive worry or fear that disrupts everyday living. People may also experience physical symptoms, including restlessness, fatigue, poor concentration, tense muscles, and interrupted sleep. A bout of anxiety symptoms does not necessarily need a specific trigger in people with GAD. Panic disorder. People with a panic disorder experience regular panic attacks involving sudden, overwhelming terror or a sense of imminent disaster and death. Phobias. There are different types of phobia, such as simple phobias, social phobia, and agoraphobia. People with OCD have obsessions and compulsions. PTSD can occur after a person experiences or witnesses an intensely stressful or traumatic event. Mood disorders. People may also refer to mood disorders as affective disorders or depressive disorders. People with these conditions have significant mood changes, generally involving either mania, a period of high energy and joy, or depression. Schizophrenia disorders. The term schizophrenia often refers to a spectrum of disorders characterized by psychotic features and other severe symptoms. According to the NIMH, signs of schizophrenia typically develop between the ages of 16 and 30. The individual will have thoughts that appear fragmented and may also find it hard to process information. Schizophrenia has negative and positive symptoms. Positive symptoms include delusions, thought disorders, and hallucinations, while withdrawal, lack of motivation, and a flat or inappropriate mood are examples of negative symptoms. Early signs. No physical test or scan reliably indicates whether a person has developed a mental illness. However, people should look out for the following as possible signs of a mental health disorder: withdrawing from friends, family, and colleagues, avoiding activities they would normally enjoy, sleeping too much or too little, eating too much or too little, feeling hopeless, having consistently low energy, using mood-altering substances, displaying negative emotions, being confused, being unable to complete daily tasks, having persistent thoughts or memories that reappear regularly, thinking of causing physical harm to themselves or others, hearing voices, and experiencing delusions. Diagnosis. Diagnosing a mental health disorder requires a multi-step process. A doctor may begin by looking at a person's medical history and performing a thorough physical exam to rule out physical conditions or issues that may be causing the symptoms. No medical tests can diagnose mental disorders. However, doctors may order a series of laboratory tests, such as imaging exams and blood work, to screen for other possible underlying causes. They will also do a psychological evaluation. This includes asking about a person's symptoms, experiences, and how these have impacted their lives. Treatment. There are various methods for managing mental health problems. Treatment is highly individual, and what works for one person may not work for another. Some strategies or treatments are more successful in combination with others. A person with a chronic mental disorder may choose different options at various stages in their life. The individual needs to work closely with a doctor who can help them identify their needs and provide suitable treatment. Psychotherapy, or talking therapies, and medication are common treatment options for people with mental ill health.